Thank you so much, Leila. So we're going to have Dr. Ezzedine come back up. We're going to do a quick 5-minute presentation on the global burden of disease and some of the work that they're doing at the ILDS. And I believe Dr. Mysrore is going to join you. Is that correct? If he's available. But you're welcome to comment on that. So, so again, trying to quantify what we're describing with the quality of life impact and the continuation of your earlier lecture. So please, Dr. Ezzedine.
This is not the right presentation putting it. They are putting again the same presentation. Maybe you should change it and put the other one. It's not the right presentation, yes.
So do you have two presentations?
It's,
okay.
Yeah, it's okay. So most of what I will say here has been already said, so I will not go in details into everything. This is a project that is born after Professor Venkatram Mysore has contacted Dr. Hamzadi and a few people dealing with vitiligo. And he asked us to work on a global atlas for vitiligo, as it is the case for a lot of skin diseases, and in particular for psoriasis. So why is it important? It is important if you want to put vitiligo on the global burden of disease project and facilitate, probably this is, Gawad, what you were saying, the reimbursement of medical treatment for the disease, and probably have a wider view on how we can help patients with vitiligo. We discussed this yesterday, and I find it very challenging to do this, because the metrics for the burden of vitiligo should be the quality adjusted life years and the disability adjusted life years that are produced through the EQ5D. It is important to measure health benefit of a therapeutic strategy, for example, and these are the questions that you found in the EQ5D. So you can see that this does not really fit vitiligo. I have no problem in working about, all vitiligo patients will tell you that. I have no problem with self-care, all vitiligo patients will tell you that. Usual activities, maybe some patients will say that they have problems with performing usual activities. Pain, discomfort, this is not really in vitiligo. Anxiety, depression, yes, this is in vitiligo. So is it appropriate for vitiligo? I think the question is open. We should also think about changing the rules for calculating the global burden of diseases, and I think it's the right time to do it for skin diseases, which have a huge impact, and there is, for the moment, at the EIDV, something that is happening for skin diseases, and we want to set up at the EIDV a special task on the burden of skin diseases. And it is important probably to change the rules and to have adequate estimator of the burden of the disease for skin. But to do this, we will need data across the world that take into account the cultural background, as I said it before, and we will need for accumulating evidence on the impact on vitiligo and beyond vitiligo of skin diseases on patient life. And I will not come again on this, but I think it's important for us in this project to take the view of those who are attending this session today and to discuss with them on how we can achieve. I think part of it has been discussed in the previous presentation, especially the need to have cohorts and registries. Registries are really important, very important tools. And we should all find ways to create registries in each country and to connect the registries of all countries together to have a common data set. And one of the things that we are working on for the moment for registries is that we are trying to produce a common protocol that we should propose to everyone who wants to set up a registry in his country. And now the questions are open. I have been very short this time.
Thank you, Dr. Ezzedine. Get us back on time. So any questions from the audience? So this is going to be one of the most important areas of development within vitiligo, and I have a question for the audience. How many of you have been asked, what are the chances that my child will have vitiligo? Yep. Now, Khalid, can you answer that question without epidemiologic data?
Can you repeat the question?
Can you answer that question of the genetic risk without...
Oh, of vitiligo, yes. It is, a lot of patients ask us, and we can answer it partially, not completely. And we can answer it partially through data like those showed by Layla. In our patients with vitiligo, almost 1/4 have a genetic background. But how this genetic background is taken is another story, because maybe we are just acting for the parents, for the grandparents, for the cousins, for who, what is genetic background? And so we have to harmonize the way we are taking those responses. And another thing that is very important, I think, is to set up a global study to assess the prevalence and the incidence of vitiligo throughout the world, to do a systematic review. This has been done in psoriasis. It's a very important task. Now that since a few years there have been a lot of publications reporting on the prevalence, on the incidence of vitiligo, we can calculate maybe with mathematical models and predict the incidence in the future year. And this is a work that I discussed already with Jung-Min and Professor Zhu, and that we need to set up in the future.
Go ahead. Dr. Maya, can we have a microphone back there, and then we'll come back to Dr. Pandya.
This stigma is very peculiar in South Asian countries and India. So I am running a self-help group in India for last 22 years, and more than 3,000 beneficiaries are there. But recently, since the June, we have started registry with the consent of patient, because many a times it happens that patient doesn't want to reveal that they have vitiligo and other things. And sir, we will be very, very obliged if you give us the standard protocol or something. We can help you in large way.
Yes, of course. I think that you have to get the consent of the patient, and you have to ensure the patient that the data are strictly anonymous,
yeah.
Which is, of course, the first thing. Before we can send the protocol, but you will need to ask for your IRB for an approval, formal approval of the protocol, and all of this are included in the protocol, of course.
So, sir, if you give us protocol as early as possible,
yes,
we can do that.
Soon.
Well, tomorrow in the morning, we will be doing a patient session. We'll be collecting domains of interest that are most bothersome to patients. So we are happy to collaborate, and we need your help.
Yes.
Dr. Pandya, you're going to finish up with the last question, please, and then we'll get on to our next talk.
There's two comments. One is that to do a registry is complicated, and to do a registry correctly is important. And so Khalid and I are involved with the Vitiligo Outcome Instrument Consensus for Evidence, and hopefully in maybe 1-2 years, we will give you the consensus of what type of data to collect for a registry. But right now there are about 5 or 6 robust registries. We can give you some advice on what you should have in the registry. The second thing I want to say is the study that we did that Khalid mentioned, I was surprised how many people have vitiligo that are not seeing a doctor. We found out they had vitiligo never having seen a doctor. They are living their lives without seeing a doctor. And I was also surprised how many were there was a higher prevalence of Latinos in the United States. As you may know, Latinos suffer from some of the worst healthcare disparities in the United States, and they don't have access to healthcare. And so, if you're thinking about doing an epidemiological study in India, South Africa, Asia, in Latin America, you have to think about some of these things. How are you going to capture the broad spectrum of people with vitiligo, and not just those with education, those who have access to a doctor, those who have access to the internet? Only then will we realize the true burden of this disease across the world.
We have thinking about all of this, and we can. I think that one of the important things in a registry is probably not to be too heavy in what we are asking, because no one will fill it. And this is the problem of TREAT, which is a registry for eczema. And this is also one of the problems that can arise from what is done actually. I think if you are asking for too many things, no one will do it. And also a registry, when we are doing it, we can do it only by ourselves, because we need funding. So we need to discuss with the industry. And we need to see with them what is important for them and what is important for us, and combine those things and come to something. And honestly, I think that we are quite close to that. And I don't think that it's the same work, this registry, than what is done. Because I think that what is done via voice is for clinical trial and daily routine clinics. And it's not exactly the thing that the wide research that should capture everything, everywhere. We should be very short, not too wide.
Yeah, sorry. The buzzer is stronger than we are.
Thank you so much.